I just really wanted to start with this big picture. And sometimes when we work within a sector, it's very hard to stand outside the sector and look into it. It's a bit like the old adage of of the wood and the trees. If you're in the trees, it's hard to see the wood sometimes. When you think about our mental health system, there's a massive paradox, and it's this. We live in one of the wealthiest countries in the world. We have a leading first world health system, including mental health system. We have some of the most amazing, passionate, compassionate medical people in the world, some fabulous people working in the sector. And yet, despite all of that, and despite all the funding that goes into the sector, we have some of the worst mental health statistics in the world. What tends to happen in Australia is we tend to focus on the system as being the way of solving the problem. So there'll be a lot of talk about, improving patient access gateways, as the Productivity Commission has recently said, making the patient the centre of the system, making the system more efficient, providing more funds into the system. But the big elephant in the room is actually the treatments that our medical practitioners have available to them don't work with a large number of people or work inadequately. And that's why so many people that come into the system with mental illness problems aren't getting out of the system well. So, we can spend as much money and as much time as we like on trying to improve the system itself, but unless we improve treatment effectiveness, we are never going to get to a situation where those mental health statistics are substantively turned around. And that's where these therapies come in, because psychedelic-assisted therapies, as you'll hear, are gaining extraordinary remission rates in overseas trials. And if they're brought into Australia, what they'll do is they'll augment the treatment alternatives available to medical practitioners and health people and their patients, so that there's more choice in terms of the appropriate treatment for the appropriate patient. So that's the big picture comment. Elephant in the room is lack of treatment effectiveness. And the great beauty of these therapies, as you'll see, is that it will give people, like the people on this call who work in the mental health sector, more ammunition to tailor the right treatment for the particular patient and the patient's problems. So with that background, we might just go straight to the animation, and from there, the presentation itself.
Okay, we'll play the animation now, please, team.
Did you know that over 45% of Australians will experience mental illness in their lifetime? That's nearly half of us.
I can't sleep. Everything feels flat and grey. I feel ashamed.
Mental ill health devastates lives and families and costs Australians around $60 billion a year. Research and treatment expenses continue to rise, yet rates of mental illness indicate that we're losing the battle. New approaches are urgently needed to address this immense suffering and cost. Psychedelic-assisted psychotherapy is currently being trialled worldwide and has demonstrated remarkable promise in treating depression, anxiety, addiction, and post-traumatic stress disorder, with new trials underway for treatment of dementia and anorexia. The treatment combines a short program of psychotherapy with just a few medicinal doses of psilocybin or MDMA. In the 1950s and 60s, psychedelic treatments had a major impact in psychiatry, and many considered it the next big thing in mental health treatment. But for political reasons, the Nixon administration criminalised the use of psychedelics and effectively stopped all research. That research has finally begun again. With proper clinical support, psychedelic treatments are safe and frequently lead to remission after only a short program, and even where current treatments have failed. Here at Mind Medicine Australia, we believe everyone should have access to the best treatments for mental illness. Subject to forthcoming clinical trial results, we will seek to establish best practice in regulated psychedelic-assisted treatment. Mind Medicine Australia is wholly focused on the clinical application of psychedelic medicines. We're preparing for change by developing therapist training, ethical guidelines, a centre of excellence in psychedelic medicine, educational material and events, and supporting clinical research. We're a small organisation doing big things, and we need your support. Please share this video and visit our website to support us and get involved.
Want to start talking about So hi everyone, we're just putting the presentation on the screen now, and bear with us, will be 1 second. Thank you. It's very weird. It's never done this before. Yeah, it's all right.
All right, I hope that animation is starting to get you all interested in the potential for these therapies to broaden the treatment paradigm in Australia. But firstly, back to those numbers I mentioned earlier on, the terrible mental health statistics we have in this country. All these numbers are sourced from government. So 1 in 5 Australians with a mental health problem, particularly disturbingly, 1 in 8 Australians now on antidepressants, and 1 in 4 older Australians, which over the last 15 years is a 95% increase in the use of antidepressants. And 1 in 2 of us likely to have a mental illness in our lifetime. So this is personal for all of us, because either we have the mental illness problem, or a close family member does, or a close friend does. At the bottom of that slide, we've listed some major classes of mental illness, PTSD, other anxiety disorders, depression, and substance abuse. The reason we've listed those is it just so happens that they're the ones where most of the trials have been done with psychedelic-assisted therapies, with, as I'll come to, extraordinary remission rates. I've talked about the general population, but as you'll all know, when you get into distinct parts of the population, the mental illness statistics can be considerably worse. And the one that's often held up is ADF veterans, where the mental illness statistics are truly terrible. But you can also look at first responder populations and distinct professions like dentistry and veterinary science, but both have significantly above average population mental illness problems. The system cost that this generates is truly enormous, and I don't have to tell the people on this webinar the massive impact on sufferers, families and carers. It also leads to significantly above average levels of unemployment. It leads to suicide, and it obviously leads to homelessness. The economic costs, and I frankly hate talking about economic costs when we're talking about people suffering, but the reality is this is costing Australia an enormous amount of money each year. Net economic cost of this, according to the Productivity Commission, is $220 billion a year. The reason that's relevant is just imagine if we could actually get more people well. That would release a huge amount of funds into the system to hopefully be applied to mental illnesses that are much harder to treat. So, Tanya, do you want to talk about treatment outcomes?
Yes, I will. We're just going to fix the screen resolution just to make sure that it's all working correctly. Just one moment. Ah, perfect. Thank you. So unfortunately, there's been no treatment improvement over the past 50 years. And what we see at the moment is only a maximum of 35% of patients experience remission from pharmacotherapy, which is primarily antidepressants or psychotherapy or a combination of the two. There's an enormous amount of relapse, and common side effects of both antidepressants and also antipsychotics are well known. PTSD is even harder to treat and remission rates are much lower. So more of the same approach isn't going to solve the problem. Oh, okay. Okay. Sorry, we're just going to have to change the resolution again because apparently we're blocking the screen. Just one moment. Okay. So we set up Mind Medicine Australia in early 2019, and our goal is to help alleviate the suffering caused by mental illness in Australia through expanding the treatment options available to medical practitioners and their patients. Our goal is to establish safe and effective psychedelic-assisted treatments to cure a range of mental illnesses. At the moment, our primary focus is on psilocybin for depression and MDMA for PTSD. We're also interested in other psychedelics which are being trialled around the world and used around the world, including ketamine, ibogaine, ayahuasca and DMT, and LSD is also being studied, as is 5-MeO-DMT. Success would be that these therapies become an integral part of our mental health system. So if you go to your medical practitioner, this will be one of the first line treatments that you're offered, and you and your doctor will discuss what is the most suitable treatment for you with full disclosure on the benefits and any risks. Our goal is that the medicines would, of course, continue to achieve very high remission rates, and we'll show you some of the research during this presentation so you can see what those rates are in the current and recent trials, and that these medicines become accessible and affordable to all Australians in need. We've put together a board of very diverse leaders from around Australia, including the former head of the Armed Forces, Chris Barry, Dr. Eli Kotler, who's a leading psychiatrist in addiction and trauma, Dr. Simon Longstaff, who's the head of the Ethics Centre in Australia, and he says that it's unethical for these medicines not to be made available to patients who are suffering in medically controlled environments. We also have the former Trade Minister, Andrew Robb, who's been suffering with treatment-resistant depression for 43 years. We also have a wonderful team, and there you see Alana, who will speak shortly, and the rest of our team, and our ambassadors, who are some of the leading researchers in this field globally. We also have numerous psychiatrists on our advisory panel, globally and from around Australia, and more psychiatrists joining us every day. And then we have medical practitioners, as you can see, enormous range of them, and clinicians, pharmacologists, religious leaders, lawmakers, natural medicine and anthropologists, and lots more. So, as I mentioned just before, our focus is on these two medicines because these two medicines, psilocybin and MDMA, have both been granted breakthrough therapy designation by the FDA in the US, which is only granted to medicines which are considered vastly superior to existing treatments. And the designation is granted to fast-track the approval process. Medicinal psilocybin is now also being trialled for obsessive compulsive disorder and addictions, and as you saw on the video, also for dementia, eating disorders like anorexia, and even cluster headaches. MDMA for PTSD, but also is being trialled for alcohol addiction, and there's a really interesting trial going on in the UK for that at the moment. The remarkable thing about these medicines is they only require 2 to 3 dose sessions, in contrast to conventional treatments which might require daily medications or weekly psychotherapy, often for decades or the entire length of a patient's life. These 2 to 3 dose sessions are in combination with psychotherapy, but it's not a lifelong treatment. The goal is that patients, after these dose sessions, will actually go into remission, and we'll talk about some of the research around that in a moment. So the medicines are curative, not palliative. So we're not simply talking about managing conditions. We're talking about actual healing, hopefully for life. And the medicines are also considered very safe in medically controlled environments and are non-addictive. The medicines are administered in a medically controlled environment. And Alana, did you want to just talk to just the 3 phases of the treatment?
Absolutely. So, before a patient engages in psychedelic-assisted psychotherapy, they're screened for their mental health profile, their risk, and their diagnosis, and of course the evidence care team to support them through this journey. Then they engage in preparation sessions where they might discuss their intention for the psychedelic journey, as well as psychoeducation and preparing them for what is to follow. Then there is typically 2 or 3 dosed sessions and separated with integration sessions in between, so that the patient is able to experience the journey and then be supported throughout with therapy. The session typically occurs for 8 hours, and there is 2 trained guides in the room, as well as a medical professional on standby to ensure that they're safe. And then after they've experienced the dose sessions, they can continue with psychotherapy to make sure that they can integrate their experiences, their insights, and what they've learnt into their life.
Okay.
How's the slideshow going, Tanya? It's a little bit blurry.
Yeah, so we actually apparently, the slides are very blurry. Is that what you're experiencing, Alana?
Yeah, can't see them.
You can't see the slides?
No.
Okay.
It's very blurry.
Yeah, okay. So we're just going to do them from Alana's machine. Okay, sorry. So you can't see this slide at all, or?
I can see it, but it's like faded, blurred.
Okay, no problem. Sorry about that, ladies and gentlemen. I'm not quite sure why that's happening. So we'll move on now to the next slide. This is a slide which shows just how strong the clinical safety record is for these medicines. So in a recent and current 120 trials, there's been no adverse events whatsoever. And you can see there actually a patient undergoing the treatment. They have on an eye mask, headphones, so they're listening to a playlist. And there's 2 therapists there who are supervising the patient and supporting the patient through this process. And you can also see how that room, which is actually in a clinic, has been made to look a lot more comfortable, so that the patient feels safe and as much at home as possible and can just relax into the experience. We will provide the presentation for everyone again, so that you can see the slides clearly. Alana, next slide, thank you. This is a recent piece of research that was done by the University of Melbourne, which shows the relative drug harms between all the different main classes of drugs in recreational environments. And in the blue, you can see harm to self, and the red, harm to others. So you can see there that alcohol is by far the most dangerous drug to self and others. And down the other end of that chart, you can see how relatively safe, even in recreational environments, psilocybin and MDMA are. So it's a very, very interesting piece of research there. Next slide, thank you, Alana. The other thing that, really stands out about these treatments is patient testimonials. And on our website, you can see many, many patient testimonials, but this is just a little snapshot of some. But patients will say things like, I felt I went through 15 years of psychological therapy in one night. That the healing was transformational, that if people had these experiences, wars would be impossible to wage. So they truly are transformational treatments. And the patient remissions are extraordinary. Next slide, thank you. So here's some of the remarkable effect sizes. So this is the Cohen's D scale. The normal effect size for an antidepressant's around D equals 0.3. Whereas psilocybin for depression, you're seeing effect sizes of 2.0 to 3.1. You can also see high effect sizes there for psilocybin for alcoholism and MDMA for PTSD and so on. So the outcomes are truly off the charts and are sometimes 6 to 10 times more effective than current existing treatments. Next slide, thank you. One of my favourite slides here. So this is a little bit about how the psilocybin treatments work for patients. So effectively, psilocybin alters the communication between the neural networks, especially around the default mode network. The default mode network is what keeps us stuck in very rigid and repetitive styles of thinking, like what we saw on the video, I'm not good enough, things won't work out, and so on. And you can see there on the right, two representations of fMRI scans of a patient with depression. So you can see on the right-hand circle, the very limited neural networks, neural connections that are happening from these very stuck thought patterns. Whereas on the left, you see the intervention with the psilocybin, the increased neurogenesis that occurs in the brain, the increased neuroplasticity, and the reconnection of old neural pathways. And this creates an incredible sense of oneness and connection for the patient. And it is that sense of oneness and connection which allows the patient to have a window open for healing to occur. Some people describe these medicines as resetting or rebooting our brain or our computer chip. Some people describe it as defragging the cluttered, dodgy computer disk that we haven't cleaned out for a long time in our lives, the baggage that we carry in our lives. And it's sort of like wiping the slate clean, not that you lose your memory or anything like that. And certainly, if anything, these medicines improve your brain function. They certainly don't diminish it. The other thing about these medicines is that they really empower patients in their own healing process, so that patients feel a sense of empowerment for their own healing and don't feel like they need to be necessarily taking medicines for the rest of their lives, and that they can actually lead a meaningful and contributing life going forwards. Next slide, thank you. The other remarkable thing about these medicines is the way in which remission treatments have been shown to improve over time. And of course, this is very different to current existing medicines, where quite often a patient will have a medicine, they will then plateau in terms of the healing treatment. You know, it will either drop off altogether or the patient will not be feeling the effect of the medicine, at which point the medical practitioner will then either double the dose or try something different. It's a little like a lottery, because people are not really sure that the treatment that's being provided is going to create a remission. So it's really remarkable to see these sorts of outcomes, and we'll talk further about these in a moment. Next slide, thank you. So the next slide is about medicinal MDMA, psychotherapy for PTSD. And it's important to say that MDMA is not ecstasy. So ecstasy, the street drug, often is adulterated with a range of different substances. In fact, a lot of the capsules that are provided on the street don't even have MDMA in them at all. And they're often taken in high doses. Usually it's completely unknown what is in the capsule, often taken in combination with alcohol and dehydration, which leads to a lot of the bad rap around MDMA, unfortunately. Pure medicinal grade MDMA, GMP grade MDMA, is an entirely different proposition, and in a therapeutic setting decreases fear and defensiveness while increasing empathy, trust and safety. So the patient has an incredible sense of love and warmth and being held safely. And that medicine decreases the activity of the amygdala, which is associated with traumatic memory. And one of the remarkable things about MDMA therapy is that it allows the patient to talk about their trauma in a safe environment instead of being re-triggered or re-traumatized, which is often what happens when a therapist tries to talk to a patient about a traumatic event, is they become re-triggered and re-traumatized, unable to talk about the trauma. That triggers the fight or flight mechanism, and unfortunately that can actually have detrimental effects on the therapy, and the patient may drop out of therapy altogether and become worse. So MDMA is a true catalyst for improving the therapeutic process and the outcomes of that. And you can see that in a recent phase 2 trial where there were 105 participants, all with treatment-resistant PTSD for an average of 18 years. 52% of those patients went into remission immediately after the 3 sessions with MDMA, which is remarkable in itself, and 68% had gone into remission at the 12-month follow-up after significant integration with their psychotherapists. That's against about a 20% remission rate from current existing treatments. And as a result of that, MDMA is now in phase 3 trials at multiple sites in US, Canada, and Israel. And the interim analysis of those trials shows a 90% or greater probability that there'll be statistically significant results. And MDMA is likely to be prescribable in the US in 18 months. Next slide, thank you, Alan. Well, we've already mentioned a number of the other different conditions that are being trialled for these medicines. And what we're also starting to see is expanded access and compassionate access schemes around the world, which are providing access to these treatments for physicians to treat patients on a case-by-case basis who are treatment resistant and who are at risk. So in Australia, that is the Special Access B scheme, which has been used for medicinal cannabis. And we've seen a number of approvals already take place in Australia through the TGA for psychiatrists and prescribing doctors for both psilocybin and MDMA-assisted therapies for their patients. So those approvals are happening federally, but what we're seeing in some states are impediments in the law where unfortunately, there's old laws that relate to recreational use, and the medicines are unable to be taken into some states where those impediments in the law exist. So we're working at the moment to work with those state governments to look at ways that exemptions can be made for medical use. So, for example, in New South Wales, there's impediments, but in Victoria, it's more simple to bring the medicines in to treat patients. The other thing that we're seeing is a number of states in the US decriminalising psilocybin possession, and Oregon has become the first state to actually legalise psilocybin for therapeutic use just recently. And we also have seen Canada actually legalise the use of psilocybin for treating patients with an end-of-life diagnosis who are suffering severe anxiety and depression. Next slide, thank you. These are some of the institutions globally who have major research programs with these medicines, including Harvard, Imperial College, Yale, Oxford, and so on. And on the next slide, thank you, Alan, we have some recently announced centres of excellence. The Imperial College in London, the Centre for Psychedelic and Consciousness Research at Johns Hopkins University. I'm also seeing now trials and centres being set up at Berkeley, also UCSF and other places around the world. And we're looking at setting up the first Centre of Excellence in this space also in Australia, and we'll talk about that further. Next slide, thank you. Next slide. So historically, these medicines have been with us since ancient times. They've been with humans since really the beginning, and you can see evidence of that in the archaeology of ancient Greece and Rome, where you can see some of the psilocybin mushrooms in the archaeology, in ancient cultures in Southern America and Mexico. There's ongoing use of these medicines through the ages for both healing and raising of consciousness. In the 50s and 60s, over 40,000 patients took part in therapeutic psychedelic sessions for a range of different conditions, and psychedelics were considered the next big thing in psychiatry. Stan Grof, who's one of the leading psychiatrists of his generation, said psychedelics would be for psychiatry what the microscope is for biology and medicine, or the telescope is for astronomy. Next slide, thank you. So what happened was, unfortunately, these medicines got caught up in the war on drugs, which is an entirely political war. It was not based on science, sadly. And the Nixon presidency decided to really attack the anti-war left and Black people. And instead of attacking, people for being Black or hippies, which obviously they couldn't do, they went after the drugs, and that was the way that they really managed to unfortunately criminalised the use of all these medicines from 1970, which resulted in research funding ceasing really until the last 10 to 15 years. Professor David Nutt, who's on our ambassador panel and the head of neuropsychopharmacology at Imperial College, says this is the worst censorship of research and medical treatment in the history of humanity. And if you think about the last 50 years, the terrible increase in loneliness, social isolation, depression, division in our community, you can only wonder what might have been possible had these medicines had been continued to be used and researched, you know, through the past 50 years. Anyway, we are where we are, and we just have to go forward from this place with positivity. Next slide, thank you. So here you see this remarkable renaissance with these medicines, and we're now back above the research that we were back in 1970. So you can see all these diverse trials from around the world, MDMA, psilocybin, and other trials taking place. Next slide, thank you. And we're also seeing a massive expansion across the ecosystem of for-profit commercial companies around the world who are setting up clinics, looking at agricultural expansion of and growing these medicines, manufacturing the medicines, reinventing molecules. There's a lot going on globally. There's probably not a week that goes by where we don't see a new startup in this space. Next slide, thank you. So we're focused on 4 key strategic areas to build the ecosystem for these medicines in Australia and New Zealand. So education and events like today are very important, where we can help educate people about these medicines and the science behind them. So we hold a range of different information sessions, we hold screenings, and we really welcome you to sign up and join our updates so that you get notifications. Last week we had Dr. Stan Groff on a webinar with us, and the week before that we had Dr. Rick Doblin, and we've got Dr. Gabor Mate next year and others. So we really encourage you to jump on our webinars and join us for all our events. We have a major international medical summit in November in Melbourne with some of the leading researchers and doctors from around the world. We're also looking at promoting and funding relevant research in the space, and we've started state and regional chapters in Australia and New Zealand, and we really invite you to join those chapters and get involved and support this work. We can't do this alone, and our entire focus is to try and help people who are suffering, and there are millions of people suffering in Australia at the moment. We also have launched the first certificate in psychedelic-assisted therapies, which is commencing in January, the first intake, the second intake in July, and ongoing intakes after that. They are for psychiatrists, psychologists, and others. I'll come to a slide on that in a moment. The first intake is full with a wait list, but there are places in subsequent intakes. As I mentioned before, also looking at setting up the first Asia-Pacific Centre for Emerging Mental Health Therapies in partnership with universities in Australia for applied research and development, development of supply chains and agribusiness, economic modelling, and so on. We're also looking at the preferred legal and ethical frameworks. We've made rescheduling applications for both psilocybin and MDMA recently, and we expect an interim decision on those applications in February. And we will also talk in a moment about our psychological support service, which is run by Dr. Alana Roy. And we also have a rollout strategy with clinics. Next slide, thank you. So this is Tim Ferriss, who's one of the leading philanthropists in this space. Many of you will know of Tim's work, obviously, and he has invested a lot in this space and donated a lot in this space because he's a well-known person in this space and basically sees this as the best way to affect millions of lives. So even if you've only got a small amount of disposable income, it is worth really getting on board with this and becoming a supporter because you and this movement can affect all of our brothers, our sisters, our mothers, our fathers, our children, our friends who are suffering with mental illness. Next slide, thank you. How you can help: share this information, start conversations, join our chapters. We We have a great Learn section on our website. Obviously many of you are medical professionals and some of you are patients with lived experience and so on, but you know, talk to other doctors and medical professionals and get them up the curve about these medicines. Help us fundraise or donate. You might have an event with your children's school and want to help us in that way. Follow us on social media. Talk to local MPs. That's really important. We're talking to as many MPs as we can so that they can help with regulatory change and join our other events, our summit and so on. Next slide, thank you. Next slide. So this is a certificate in psychedelic-assisted therapies. This is really to train psychologists, medical practitioners, psychiatrists, occupational therapists, social workers, mental health nurses, addiction specialists, psychotherapists and counsellors. And we will, Ilan, if you can include the links that you're putting on the chat when you send out the presentation to Jim to share, that would be fantastic. Next slide, thank you. Alana?
I just wanted to take a brief moment just to really acknowledge the Mental Health Foundation, where I actually did my final psychology placement there with Jim and the crew there, and just really how incredible it is that they don't just see the diagnosis or the mental illness or the disability, they really see the person. And likewise, I, with Tanya and Peter's support, have created My Medicine Psychological Support Centre services. And it is really to keep the client centre of the story, as well as the medicines and the integrity of the medicines that we're working with. So the services that we offer are individual counselling, as well as assessment for SASB suitability and therapeutic support and diagnosis, group integration for people in the community that may be working with the medicines. We want to make sure they're safe. We don't endorse recreational use, but we are providing services all around Australia to people who deserve, to have high quality mental health services in Australia, and if they choose to go overseas for these medicines. We do a lot of professional consultation and training and clinical supervision for students in group settings and individual supervision. And we also have access to bulk billing, private health and NDIS services. So many people are using their plans through NDIS for integration support or for therapy. And what's really incredible about this service is that we are having clients from all around Australia make contact, even if they're not interested in psychedelics. They want a therapist that is open to transformative states of consciousness, that is able to hold discussions around spiritual emergence versus psychosis. And, really we've created a safe platform for people to have an alternative to the current modes of treatment, which are really limited. So please feel free to reach out and make contact with me. We also offer supervision services and student placements for social workers and community development and a whole range of students. So if you're looking for a placement or would like to volunteer, please make contact.
Thank you, Alana. And next slide, Alana. So this is about the rescheduling. So everyone, please keep your fingers and toes crossed. Next slide, thank you. And this is who's speaking at the summit in November 2021, but I'm pleased to announce that we have just also confirmed Dr. Gabor Mate, and we've also confirmed Dr. Johan Hari, who is the person who wrote the wonderful book Lost Connections and Chasing the Scream. So really encourage you to join us at that summit. Next slide, thank you, Ilan. Where is our upcoming webinars?